and welcome to the Axiom Medical COVID-19 Vaccine Facts versus Fiction live stream that we're hosting today. Just a quick background. My name is Holly Foxworth, and I am one of the registered nurses. I'm also the marketing manager for content here at Axiom in case you've stumbled upon our feed or you're new and you're not familiar with who we are. But as always, I do have a brilliant team, the best minds in medicine and communication, both that are going to be joining our panel today. We have Dr. Scott Cherry, who's our Chief Medical Officer. We also have Dr. Peter Matos. We have Chief Marketing Officer Dara Wheeler, and then also Communications Director Autumn Brennan. So they're going to walk us through some of those most recent myths that have been floating around, whether that be on TV, on social, etc. All right, Dara, I'll come to you with the next one, which was specific to side effects. It does feel like that whenever that initial pause was given for the Johnson & Johnson vaccine, that it was like all of a sudden everyone was very attuned and alerted to potential side effects that, especially when it occurred with the Johnson & Johnson, they're now giving those again. But are you seeing that there has been significant side effects or anything that you've experienced yourself that should be of concern?
Yeah, we're hearing a lot about side effects, and people are almost on social media making it a little bit of a game of comparing side effects or theorizing about side effects. But what we're seeing, and we're running a lot of vaccine clinics ourselves, and so we're seeing a lot of the direct access to people that are vaccinated, and we have seen that, like any vaccine, it can cause mild side effects such as low-grade fever, pain, or redness at the injection site, but majority of the reactions are mild and go away within just a few days. Very rarely are there any long-term or serious side effects, and we do track that very carefully and track any sort of adverse reactions to the vaccine, and not seeing very many of that. But what I also recommend, as we've mentioned before, Dr. Mato said this and others have said this, if you're ever concerned about your current health and whether you should get the vaccine, you should always talk to your physician about that. Or like Dr. Mato said, if you're immunocompromised or have other concerns, then that should be a component of what you evaluate in the risk in getting a vaccine. But in general, the risk of a side effect in this vaccine is very low.